Parkinson's disease is a movement disorder of the nervous system. Symptoms start slowly. They can be different for everyone. Joining me in the studio today is Dr. Julie Kurek, a movement specialist in the Neurology Department at Augusta University, Wellstar MCG. And Doctor, it is a delight to have you on the program.
Thank you so much for having me
Thank
here
you.
today. I appreciate it.
I think when Robert J. Fox got Parkinson's disease, it really raised a lot of awareness, and folks have been a little bit more in tune to this issue. But the symptoms, they're not always so visible at first, are they?
They are not. That's exactly it. We kind of describe it as an iceberg. You know, most people think of Parkinson's as tremor and stiffness and difficulty walking, but we refer to that as sort of the tip of the iceberg. And there's a lot of stuff, most of the stuff happening underneath the water, which is constipation, sleep disturbances, loss of smell, nervous system issues, bladder issues, and those are usually some of the first signs that precede the visible ones by many years.
So is it important to be screened, or how do you know if
It
you have
is.
it?
I think it's important to be aware of what the possible symptoms are, because early intervention and the right therapy significantly improves the quality of life.
Now, I love what you're doing. You have some very important programs coming up for the next several months and beyond. So tell us a little bit about that.
Right. I want the community to kind of know as much about Parkinson's and identify. So we're having a series of kind of free outreach educational events for the following few months. Our first kickoff one will be this Friday in a couple days. And we'll have another one in November. In the meantime, a series of virtual ones that are focus on a specific topic.
And you have a flyer that you've been passing out.
We
handing
do.
around.
We do have a flyer.
And I think we even have a graphic of that right now. And there is a QR code that if you point your phone in that direction, possibly you'll be able to learn more information. And this is so important for people who may have that tip of the iceberg and not realize it.
Exactly. And studies have shown that early intervention really significantly improves lifespan, quality of life, morbidity, and mortality.
What about treatments now? Are we seeing better treatment for Parkinson's?
We are. We're seeing it's a really promising time, especially in the research field. In terms of treatments, we're having a lot of kind of reinventions of levodopa. It's now come in IV form. There's pumps and gels and powders and different things like that, as opposed to just the pills, super long-acting pills.
Right.
We're still looking for the holy grail is something that is disease modifying, we call neuroprotective.
Right.
And that's why early identification is important, because as an academic medical center, we offer clinical trials sometimes for people who are untreated and early on to see if we can modify and really kind of slow down this disease.
Well, we have to leave it there, but I hope you'll come back and talk more about that.
I would love
soon.
to. Thank you so much.
Thank you, Doctor. Good to have you. We'll be back.